So, I mean, this is pretty basic. You're seeing the action. You can't quite see what I'm doing, but I'm starting fairly low, and now I'm working my way up, and now we're at the thyroid cartilage level. And then we're working our way up to thyroid space, and finally at the highway. Nothing very remarkable, right? But what if we shifted laterally? And now what I'm going to do is I'm going to do a little upward, and there you can see it coming out lower left, and then working my way down. Upward and downward. Now, left side, upward and downward. Nothing very remarkable, you're just seeing the internal response. I'm now going to try. There's laryngeal elevation and depression. Now, I can see that I'm applying an asymmetrical force. You can see the reaction there, right? I don't have the benefit of fees to know that, but that's why I'll often reverse my bias, right? We try some work with one hand, and then we reverse and go into the other hand. If we did see an asymmetrical movement with both hands, to me, that creates some curiosity. It doesn't mean it's pathology, but it creates some interest in me. I'm definitely seeing a different response from one side to the other. And you may be able to make something out of that I can't, because I'm not fees trained. This is my things, but if you're seeing things, how would you respond to that? What other things might you want to do in response to that? I'm now going to do my laryngeal depression, where I'm coming into the thyroid membrane. Okay. And I'm going to drop. It's nothing terribly remarkable, except everything just sort of moves away from the view a little bit. And thus far, everything's been in silence. If he was a voice patient, I would get him to be voicing when we're doing this. Just like his nervous system, he's picking up the differences in movement, etc. I would love for somebody to take this concept, not just of using fees, of combining it with some of these things, not just from an observing treatment perspective, but in certain type of situation, is there a diagnostic value? Just because what happened on the screen in Shelby, where she was only able to see some of those asymmetries when we did this, is there a diagnostic value with some patients? And I don't know the answer to that. But with you now, with knowing semantic therapy, and possibly having access to fees, are there combinations blending it for the diagnostic aspect of this work? And I just sort of lay that out, because I don't know.